If you're over 50 and managing knee pain with ibuprofen every day, or just gritting your teeth and accepting it as part of getting older, I want you to hear something before you take another pill. There's a randomized clinical trial where castor oil went head-to-head against a standard prescription anti-inflammatory for knee osteoarthritis. Same effectiveness over 4 weeks. 0 side effects in the castor oil group. Significant adverse reactions in the drug group. And almost nobody has heard of it. That's what this video is about. Not a trend, not a folk remedy. The actual science, what's in castor oil, what it does to the tissue in your knee when you apply it, and why doing it at night specifically makes a difference. Let's get into it. Castor oil is made from the seeds of the Ricinus communis plant, and unlike most oils, its composition is unusual. About 85 to 90% of it is a single fatty acid called ricinoleic acid. That concentration is one of the highest of any single compound in any plant oil on Earth. Ricinoleic acid is what makes castor oil medically interesting. Here's the specific mechanism that matters for knee pain. Research identified that ricinoleic acid activates something called the EP3 prostanoid receptor, a receptor found in smooth muscle and inflamed tissue that plays a direct role in pain signaling. This is the same receptor system involved when your body triggers an inflammatory pain response. Ricinoleic acid essentially talks directly to that machinery. It's not numbing the pain the way ice would. It's interacting with the biological pathway that generates it. In plain terms, this oil has a documented way into the pain and inflammation system in your joint. That's why the research looks the way it does. I'll be honest, I've seen people come in who've been on anti-inflammatory medications for years and were never told there was an alternative with comparable clinical research behind it, not as a replacement for medical care, but as something real with evidence worth knowing about. The first thing that changes: pain, measurably, consistently, over weeks. This is where that clinical trial becomes important to understand properly. Researchers in India ran a randomized double-blind study, 100 patients with knee osteoarthritis, split evenly into 2 groups. One group took castor oil capsules 3 times daily for 4 weeks. The other took diclofenac sodium, a standard prescription NSAID, the same class of drug as ibuprofen, commonly used for arthritis pain. Both groups were evaluated at 2 weeks and 4 weeks. Both groups showed significant improvement in pain. Statistically significant, the same result. But here's the number that stops people. The diclofenac group reported significant adverse drug reactions. The castor oil group reported 0, not fewer. 0. That's not a small distinction. Long-term NSAID use carries real risks: GI damage, cardiovascular strain, kidney stress. These aren't rare. They accumulate quietly over years in people who take these drugs daily because they have daily pain. The fact that castor oil produced comparable relief without touching any of those systems is exactly why this deserves more attention than it gets. The second thing that changes: morning stiffness starts to ease. Pain and stiffness are related, but they're not the same thing. Pain is what you feel. Stiffness is what you can't do. The range of motion that's restricted, the first steps out of bed that feel like your knee needs 30 minutes to remember how to work. Ricinoleic acid's anti-inflammatory properties address both. The same EP3 receptor activation that modulates pain also reduces the inflammatory environment around the joint. And it's that environment, the chronic low-level inflammation that builds up in the tissue surrounding the knee, that drives stiffness as much as the joint damage itself. Reduced inflammation means the tissue around the joint is less swollen, less tight, less resistant to movement. The first steps in the morning get a little easier. The warm-up period gets shorter. It doesn't happen overnight. But with consistent nightly application over 2 to 4 weeks, it's one of the first changes most people actually notice. The third thing that changes: the skin and tissue around the joint starts to respond. Castor oil is one of the densest, most viscous natural oils that exists. When you apply it to the knee, it doesn't absorb quickly and move on. It sits on the skin, slows moisture loss, and penetrates slowly through repeated application over days and weeks. This is what that does to the tissue. The skin around the knee softens. The supporting tissue, The tendons, the ligaments, the connective structures surrounding the joint becomes less rigid. People describe it as the knee feeling less armored, less braced, like something that was held tight is finally allowed to release a little. That matters because knee pain isn't only inside the joint. A significant part of it is the surrounding tissue responding to chronic inflammation by tensing up. Guarding, restricting. When that tissue gets consistent, anti-inflammatory input night after night, it starts to let go of some of that guarding response. You notice it as more ease, not less pain exactly, though that comes too. More ease in how the knee moves through its range. Less of that feeling that the joint is operating against resistance. This is the part I want you to sit with for a moment. Knee pain that goes unaddressed doesn't stay the same. It compounds. The tissue tightening up to guard the joint starts to restrict movement, and when movement decreases, the joint environment actually worsens. Less lubrication, less circulation, more stiffness. More stiffness brings more pain. And somewhere in that spiral, without realizing it, a person starts making different choices. They stop suggesting the restaurant with the stairs. They book the hotel room based on elevator access, not what they actually want. They watch from the sidelines at things their grandchildren are doing because getting up and down from the ground has become a calculation, not a reflex. They stop booking certain trips, the ones with cobblestones, with hills, with days that require more walking than they're sure they can manage anymore. It doesn't happen all at once. It's 100 small withdrawals that add up to a life that's quietly smaller than it used to be. I've talked to people who only connected the dots after the fact, who looked back and realized they'd been reorganizing their world around their knees for years without naming it. And what they almost always say is, "I wish I'd taken it more seriously when it was still manageable." It's still manageable. That's the point. That's why this matters. The fourth thing that changes, and this one is about timing, why doing it at night is the right call. During the day, you're on your feet. The knee is bearing weight, bending, straightening, constantly moving. Any oil you apply gets diluted by friction, absorbed into clothing, worn off by activity within an hour. At night, none of that happens. When you apply castor oil before bed and leave it on, the ricinoleic acid stays in direct contact with the joint tissue for 7 or 8 hours. Body heat under the covers warms the skin slightly, which improves absorption. The joint is at rest, not under load. There's no movement pulling the oil away from the tissue you're trying to reach. That's 8 hours of consistent, low-level anti-inflammatory contact with the knee every single night, compounding over weeks. Compare that to applying the same oil in the morning and having it gone by the time you've made coffee. The timing isn't incidental, it's the whole mechanism. Night is when your body is already trying to repair itself, and you're giving it the right raw materials to do that more effectively. The fifth thing that changes, what you stop needing as much. Most people managing knee pain long-term are taking something for it. Ibuprofen, naproxen, something in the NSAID family, probably more days than not. And nobody loves that. They take it because the pain is real and the alternatives feel vague and unproven. NSAIDs work, that's not in question, but they carry costs that accumulate quietly over years. GI damage, increased cardiovascular risk, kidney strain with long-term daily use. These aren't rare. They're documented consequences of using drugs that were designed for short-term relief in people who end up taking them every day for decades because the underlying pain never got properly addressed. The clinical trial comparing castor oil to diclofenac sodium showed comparable pain relief. If you take that finding seriously, and it's a randomized controlled trial, so you should, the implication is significant. An intervention that reliably reduces pain over weeks of consistent use without touching the GI tract, the heart, or the kidneys has the potential to reduce how often someone reaches for a pill, not eliminate the pills. That's not what this is. But reduce the reliance. Take the edge off with something that has no adverse effect profile. Reserve the medication for when it's actually needed rather than using it as a daily baseline. That's a compounding benefit, because every day you don't stress the gut unnecessarily. Every day you're not adding cardiovascular load. That matters. It accumulates in the other direction. The sixth thing that changes. The massage itself is working, not just the oil. This is something most castor oil content glosses over, but it's worth being honest about, because it's actually good news. When you apply castor oil to your knee every night, you're not just depositing ricinoleic acid onto the skin, you're rubbing a joint for 2 to 5 minutes with consistent pressure and movement. Manual massage of the knee, independent of what oil is used, has documented therapeutic benefits for osteoarthritis. It promotes the movement of synovial fluid, the lubricating liquid inside the joint. It increases local blood flow, which improves nutrient delivery to cartilage tissue that has limited blood supply of its own. It stimulates the nerve endings in the joint that help regulate how much pain the brain registers. And look, none of that happens if you just pour the oil onto your knee and go to bed. The application method matters. The 5 minutes of working the oil into the tissue, moving across the kneecap, massaging along the sides of the joint, that's not preparation for the castor oil to work. That is part of the work. So what you're actually building with this nightly habit is 2 things operating together. The ricinoleic acid providing anti-inflammatory input to the joint tissue while you sleep, and the massage itself keeping the joint lubricated, circulated, and mechanically stimulated in a way that chronic pain typically robs people of, because pain reduces movement, and reduced movement worsens the joint environment. One reinforces the other, night after night. The 7th thing that changes. The skin over and around the joint. The skin directly over the knee takes mechanical punishment every single day. Flexion, extension, kneeling, pressure from every direction. And as we age, the skin thins. The collagen density drops. The barrier becomes less resilient. The skin around weight-bearing joints becomes more prone to dryness, cracking, and breakdown, which matters not just cosmetically, but because skin integrity is the first line of defense for the tissue underneath. Castor oil is one of the most effective natural moisturizers available. It forms a barrier on the skin that slows water loss, keeps the underlying tissue hydrated, and over consistent use, measurably improves skin texture, suppleness, and resilience. A 2025 dermatology review confirmed its documented benefits for skin hydration, wound healing support, and anti-aging properties at the tissue level. Applied nightly to the knee. This means the skin over the joint stays healthier, more flexible, and better protected. Less cracking around the kneecap. Less tightness in the skin when the joint bends fully. Less of the dry, papery feeling that makes the area feel fragile. It's a quieter benefit than the pain reduction, but it's real and it compounds in the same direction as everything else. How to actually do this, and what not to skip. We already covered why the massage itself does real therapeutic work, so here's exactly how to apply it. Start with the oil. Choose cold-pressed, hexane-free castor oil. Not castor essential oil, that's different and not what you want here. Not Jamaican black castor oil, which is processed differently. Plain cold-pressed castor oil from a reputable brand. It's inexpensive and widely available. Warm it first. Put 8 to 10 drops in your palm and rub your hands together for 10 to 15 seconds before touching the knee. Warm oil absorbs better than cold oil. If you want to go further, set the bottle in warm water for a few minutes beforehand. Apply it in sequence. Start at the kneecap itself. Work the oil in with small circular motions. Then move to the sides of the joint where the tendons attach. Then along the soft tissue above and below the knee. Spend 2 to 5 minutes per knee. This isn't perfunctory. This is the massage component that does real work. Don't rush it. Cover the knee. A thin pair of loose cotton pants or a light knee sleeve worn loosely keeps the oil in contact with the skin through the night rather than transferring to your sheets. It also retains a small amount of warmth, which supports absorption. Do it every night for at least 30 days before you decide whether it's working. The clinical trial that showed comparable results to diclofenac ran for 4 weeks. Consistency is the mechanism, not any single application. One safety note: do a patch test on the inner arm first if you've never used castor oil on your skin. Reactions are uncommon, but they do happen. Stop immediately if you develop redness, itching, or irritation. If you have open wounds, broken skin, or an active infection around the knee, Wait until that resolves before starting. If you're on blood-thinning medication, check with your doctor. Castor oil has mild anticoagulant properties that are worth a brief conversation. That's it. 30 nights, a few minutes each night. An oil that costs almost nothing and has a randomized controlled trial behind it. Your knees will tell you if it's working. Subscribe if this was useful. There's more on this channel worth knowing.